good morning and very, very welcome to each and every one of you for coming along to our Self-Directed Support Community of Practice seminar. And we open our seminars to everyone in the self-directed support community and beyond to share interesting things that are going on in the SDS world and to encourage new people to get involved in what we're doing. So thank you, great to see you all today. Last year, our project, the Social Work Scotland Self-Directed Support Team, had a dedicated work stream that some people in the room today will have been part of, that was about relationship-based practice and self-directed support. And today we are absolutely delighted to be able to share the learning from that work so far. We have the privilege of working with Dr. Emma Miller from Strathclyde University. Emma's worked as an independent researcher for us on this piece of work, and she's going to share the detail of what we've done with the community of practice and beyond last year. And then we're going to hand over to Dr. Jane Kellock, who's our project lead, and she's going to describe to us a little bit of the steps, the next steps, the direction of travel for the next phase that this relationship-based practice and SDS work will take. And then we hope that we have an hour-long session. We hope that there will be some time for questions, for your observations, for your reflections, and for a bit of discussion. But we have a big group today, so we'll try our absolute best to manage that. When I've handed over, I will drop our email address into the chat so that if anybody after today wants to get in touch with the team about either this piece of work, relationship-based practice and self-directed support, or anything else, you'd be very, very welcome to get in touch with us, because I'm thinking we're probably not going to get round everybody's questions and comments.
How can you hear that? I didn't realise.
Sorry, folks. Is somebody having a wee bit of trouble with their mute button there? Okay. Yeah, if you can, if you're able to, if you could be on mute whilst you're not talking. And if you're having trouble with your mute, maybe just try your best to be quiet. But either way, we'll work round it. Digital things are always fun that way. So I'll lead you into, I'd love to welcome Emma to take the what is it they call it when they put you in the box where you're the one that can always be seen? I don't like that. I want to be off that now. I'll hand that over to Emma, and I think Callum is going to kindly share a few slides. So hope you enjoy the morning. Looking forward to the discussion. Thanks, folks.
Thanks very much, Laura, and it's lovely to see everybody in the room and to see quite a few people who were involved in the project at the end of last year, as well as some other familiar faces. So really just to run through the findings of the project, which, as Laura said, involved the SDS Community of Practice and 3 webinars at the end of last year. So this is very much based on what was shared with us by people who took part in those webinars. And what I'm going to do, first of all, is start by talking about the who, what, where and why of the project. So if Callum, you could move on to the next slide, please. Oh yeah, and first of all, a reminder of the work and how it's commissioned to consider how relationship-based practice is understood within the self-directed support community of practice. And part of what we were doing was trying to collect examples of good practice. So we do have a report which draws all of that learning together, including some really lovely examples of good practice from different areas in Scotland and from different perspectives. But also looking at the barriers to implementation. And I think that's a really important part of the project, because I guess there's something in the background, and it came up in the discussions about the range of different initiatives that we've had over a number of years, including person-centred practice, outcome-focused practice, strength-based approaches, and others. And relationship-based practice being something that's been around for a while, but is kind of re-emerging at the moment. And I think there's something important about the barriers to implementation, which are common to all of them, but we will come on to them slightly later in the presentation. So yeah, very much one of the 7 work streams being progressed by Social Work Scotland around SDS, and we had particularly strong links with the finance work stream and also training. And we had a workshop in Edinburgh at the end of December to look at how to bring those closer together. But again, that might come up later in the discussion. So just the background, and then the next slide, please, Callum. Oh yeah, and so a couple of the next slides are really about linking this in with other things that are going on in Scotland. And just around the time we were starting the work in autumn last year, there was the post-legislative scrutiny, none of us can ever say that, committee, which was looking at SDS and perhaps again looking at where implementation hadn't worked so well. And one of the key areas of focus was around eligibility criteria, not working particularly well. Again, eligibility criteria came up in our discussion very much, and how they contradict the aims and principles of self-directed support. And part of the discussion in the committee was around the need to move from the current model of care management to a model of relationship-based practice. The individualised means-tested assessments that use eligibility criteria need to be replaced with community-based services properly responsive to individuals' choices and preferences. And again, in the background to the report, we address that issue around the model of care management, a new public management, and the move towards, for many years now, a much more transactional way of working that's very much about ticking boxes rather than engaging with people. So that's the kind of background to the work. And then if we move on to the next slide, please, Callum. Also referenced quite frequently by members of the community of practice were the codes of practice for social service workers and employers from SSSC. And the language there very much emphasises the responsibility of both employers and workers in forming open, positive relationships with individuals, colleagues and carers, maintaining professional boundaries and promoting kind and compassionate practice. So there is also that very strong focus within SSSC now on relationship-based practice, and work is being progressed there too. So if we move on to the next slide, please, Callum. And now we get to the who, what, where and how of the research. So the community of practice were invited to join the relationship-based practice work stream back in summer. And from memory, I think colleagues in Social Work Scotland said that the relationship-based practice work stream was one that many members of the community of practice were keen to progress most. So there was a very strong commitment from the community of practice, and we had really good attendance and really good contributions to the workshops. In total, we had 41 SDS leaders and implementers covering 19 local authorities, so really good representation from across Scotland. And also contributors from diverse national agencies, which are listed at the bottom of the slide there, which was really important, again, with that kind of focus on trying to make sure that there's a read across and a consistency of focus. We also had a mother and their teenager who had long-term experience of using social work services, and actually their contributions were excellent throughout and kept us all grounded. So we had the workshops, but also we did 7 individual interviews, and some of the stories we gathered from those interviews are the ones which are mentioned in the report. So as I've already mentioned, we had the Join Up workshop at the end of the year, joining together with finance and with training and practice development. And that was basically the conclusion of the project then. We wrote the report up at the start of this year. And I guess now we're moving into a phase of thinking about what are the practical implementations? How do we take all of this learning forward in a practical sense? And Jane will come in with some thoughts about that slightly later. So if we move on to the next slide, please, Callum. So just to kind of acknowledge the background to the report is a little bit academic-y, researchy, but important to kind of acknowledge the context of the unprecedented challenges, which I don't need to hammer on about. We're all aware of the challenges we're facing just now, you know, not just staffing and recruitment issues, but, you know, increasing inequality, which is impacting everybody in different ways, actually. And I've already mentioned the context of the background of new public management and care management, which have been with us for quite a long time now. And maybe, you know, are there opportunities given the crisis and the difficulties that people are facing to actually move forward from that more transactional way of working to centre relationships more? As one of our community of practice members mentioned, relationship-based practice is hard to do in the current robotic and assessment and review processes that we have. So the next couple of slides, we'll start by looking at some of the findings around practice. And then, so look a couple of slides on practice, then a couple of slides on the kind of more organisational side and organisational responsibilities around relationship-based practice. Before looking, I think there's one slide on the importance of making the case, because it does still seem that there are parts of the system where the understanding of the importance of relationships isn't quite there yet. And so we have to accept that we still have to make the case for this in some contexts. So just starting with the practice side of things, there was a few key themes that came up about the importance of being flexible and responsive in our practice, and you know, so while it's important to have consistent principles to work from, there are risks around taking a very standardized approach to practice. And so having the space and time to be flexible and responsive with people being so important. And time, of course, is the big challenge, possibly one of the biggest challenges that individual practitioners and organizations face, but we need to find ways to make bits of time to enable that flexibility. So one person was saying, for me, it's about saying, well, I don't really understand autism, or I don't really understand multiple sclerosis, or whatever the person's situation might be. Can you tell me about how that is over coffee? Tell me about how that affects you, because I don't really know. And so it's not just about making space for the person, but for this practitioner, they were saying it's also about empowerment and how important that is, because they're actually being given the opportunity to bring their knowledge and experience to the table. So very much a kind of exchange model of, I'm bringing my knowledge as a practitioner, but you are the one that's an expert in your own experience, but needing the time and space to do that. And I guess there was a big focus on the importance of understanding and trust, that rapport building as the basis of better decision making. So trust and space to build trust, but also how building that trust and understanding of the person enables better decision making. And within that, the importance of openness and honesty, and the openness and honesty was emphasised massively throughout the discussions. And I'll come back to it when we talk about organisational responsibilities, because there's something in there about the importance of honesty and openness at all levels to enable the practitioner to be open and honest. That was a massive theme. So again, a quote here, which was from the mother and daughter who took part in our sessions, and they had had different experiences of working with social workers. And where it went well, they said that the trust was really fundamental. And they spoke about the relationship built over time. And it meant when the social workers were making decisions, it was based on grounded knowledge about us as a family, not one of the children in isolation. And that last bit there was very much about, and I think maybe that's slightly been lost as well in practice over time, is family-focused practice rather than individual. And for this mother and daughter, the fact that the social worker knew them all meant that the decisions they were making were taking into account everyone's best interests and how that worked much better. Again, time being a critical issue there. Another key point that came up, one of the key themes, was around social work and the advocacy role. And we had a member of the community of practice who did an individual interview with us and shared some wonderful reflections, really. And I thought it was really interesting that he talked about how, you know, years ago, he would have seen the social work role as including advocacy. So he said, it's always strange to me that we've got advocacy now. When I did my training and when I started out, you were the advocate. There was no such thing as an advocacy service, really. And he wasn't decrying the existence of advocacy services. He very much saw that they had a role, but it was just, there was a sadness there about how that had been detached from the social work role. And he said that just shows the kind of distance between practitioners and people with lived experience and parent carers. So very much coming back to the importance of the social work focus on relationships. So if we move on to the next slide, please, Callum. So again, sticking with the theme of relationship-based practice, and just to say that this, I'm not covering every single theme in this presentation, but selecting some of the key themes, and the importance of setting expectations and defining boundaries came up quite a lot throughout the discussions. From the perspective of the mother and daughter who took part in the project, they spoke about the expectations and, you know, their expectations of the relationship they had with their social worker, and they said, we don't see Cara as a friend. She's our social worker. They're there to do a job, but they're there to maintain a healthy and functional relationship with us to get progress. We're well aware that stuff is always based on goals, but the goals are always realistic to our situation. So that was from a perspective of people using social work services. But that theme about setting expectations and defining boundaries was also really important to members of the community, other members of the community of practice. And I think one of the key concerns that people raised was that everything's in such a state of flux just now in terms of services, the service landscape changing, in terms of financial decision making changing within organisations, and goalposts being shifted at pace, and the communication not always flowing within the organisation, so that oftentimes social workers might not be clear about where the boundaries lie in terms of decision making, and that's got crucial implications for self-directed support. And so again, I guess the focus there was coming back to the importance of the flow of communication and relationships within the organisation, and the importance of that at times of change. It's really difficult because of time pressures, but actually if social work staff don't know where the boundaries are organisationally, it does have knock-on effects on the relationships very much that they're having with supported people. And not unrelated to that was this concept of necessary conversations, which came up from one representative from one local authority who had been doing some training and development sessions with staff, where they were saying they were finding it really difficult, that they were finding it challenging, that they were having these difficult conversations with families on a number of topics, but a key one was around, again, the change in financial and service landscape and less resource available to work with people. And finding that actually very difficult and compromising, because sometimes they might have been working with a family for a long time, but a service was disappearing or being reduced, or the person's budget was being reduced, and how challenging it is to have those conversations. But this person was saying we need to call them necessary conversations, because we have to have them, and we need to collectively find ways to have those conversations in ways that don't make people feel that they're undervalued because their service is being cut. Yeah, so it's none of that's easy stuff, but it's necessary within organisations to find ways of having those conversations. And underneath that, I guess, is another kind of tension. So this person said, to be honest, the eligibility thing screams out, because how do you align that with the kind of strength and asset-based approaches, which again is about those, how do you navigate those tensions within the conversations you're having? So where practitioners are working with tightened eligibility criteria, and which can often mean, as we all know, often means that there's more of an emphasis on what people aren't capable of doing, what's wrong with them, what crisis they're facing, what risks are around. And if that's the language that you're required to use, how do you square that with the strength and asset-based approaches, which are beneficial to everybody, especially for the supported person? And how do we marry that up? So yes, really important questions coming up there, and the implications of all of that for the relationship building. So I think that's all I've brought in about the practice side of things for just now. If we move on to the next slide, we should be looking at more of the organisational focus. And again, we drew on some of the literature that's around, which I haven't brought into this presentation. I've tried to keep it focused on the voices of the people who participated. But that concept of parallel processes, very much coming from, we found a wonderful resource by Gillian Rush, who's worked in relationship-based practice for years, and focusing on the relationship building, again, in a tiered sense. So the social worker being supported by a team leader in a relationship-based manner, and then that team leader being supported by a senior manager in a relationship-based fashion, but about how all of that builds the culture of the organisation, and so how all of the conversations contribute to the culture. And one person said, and you do have to create your own alliances to reinforce that what you're doing is okay almost. And that's okay, because in order to swim against the tide and be relationship focused, that requires a significant amount of bravery, and you need to have a level of emotional support around you. If you can't have that in your organisation, you need to have that elsewhere. And it's just important to acknowledge that there were very different experiences within the community of practice. There were people who felt their organisation was reasonably relationship focused, and that there was a permission, the word permission was used, permission to be relationship focused in their practice, but that wasn't true of everybody. And so some people did speak about having to find the support to kind of give them permission to do that elsewhere, whether that was through a community of practice or whatever. People were finding ways to find the support to do that. And so that leads into the idea of the whole system approach and creating the conditions. And again, here a quote to say, in our work locally to embed an outcome focus, we've spoken a lot about modelling good conversations, throughout the organisation. So then it is more than a practice, it starts to become a culture. And I would have to say that through years of embedding outcome focused practice and strength-based practice, I would be very resistant to any organisation saying, can you come and train our staff to do outcome focused practice, unless there's an organisational commitment to adapt and shift to enable that to happen. Training on its own never cuts it, because it just puts all the responsibility in staff, and if they're not supported by the systems and processes round about them, it's just not going to work. So if we move on to the next slide. And this is the diagram from Gillian Rush, and it's just to kind of let you see one of the resources that we tapped into, and you can see there how the family that's supported by relationship-based practice, and then the social worker supported by relationship-based supervision and support by their team leader, and then that again being replaced at senior manager level. And I'm not going to go through all the details of that slide about parallel processes, but maybe just to emphasise the very last point there from Gillian Rush, that no one should consider themselves exempt. It's everybody's responsibility to be relationship focused. So if we move on to the next slide, please, Callum. Again, on relationship-based organisations, and just two themes here is one. The first one is around the role of recording, which as people that I've worked with over the years know, it's a bit of a hobby horse of mine. I would very much see recording as an area of practice that's undervalued and not considered enough. And I very much understand why practitioners see recording as a bureaucratic burden that takes them away from the real job of engaging with people. But actually, recording can be a tool for relationship building. And so this quote here, my team work with practitioners from older and adult services. We can see there's improvement, but the way outcomes, sorry, I have tended to focus on outcomes, but I've just realised that in this presentation, it's not just me being biased, there was a lot of discussion around outcomes. So the way outcomes are recorded is very top level. So for example, somebody saying, I want to be safe. But what does that really mean to the person? Feeling safe might be, I just need somebody with me. It might mean I'm scared I'm going to fall. It needs to be teased out. What does that mean for that person, rather than safety being equated to 3 hours of home care or we need an alert? So that bit about that kind of digging in with the person or the family to build that understanding of what is it that's making them tick? What is it that they see as being their future and how they might get there? But oftentimes it's through looking at the records that, you know, that you can start to pick out where is there maybe that lack of depth, that lack of understanding, and build towards that. So I could go on about, I'm trying to stop myself from talking too much about recording now. So I'm going to force myself to move on, and just to touch on one of the other themes was about the importance of engaging with communities. And I guess this works at 2 levels. So there's one issue in there about understanding the resources that are in communities that people can be connected to, which is becoming more important now, given that there are fewer formal services for social work staff to work with. And in other work that I'm doing just now, it's very clear that staff, because of the way care management's evolved, very much have been about packages of care and funded services, that maybe that knowledge of what's available in the local community is not as good as it could be. So there's some opportunities in there, but also just the importance of working with communities in general. And there's been work in Scotland, I think it was Fife did a lot of work last year on community-based social work and some of the opportunities that there might be there. And I think that's happening in other areas now as well. So yeah, if we move on to the next slide, please, Callum. So making the case, we've been digging around, looking at what other resources are out there that we can draw on. And there's some really good work by is it called the Relationship Project in England? Yes, it is. They've got loads of resources that they've been developing over the last few years that we can tap into. I've been pulling them out. I'm going to share them with Jane and Laura this week. But I thought, so they have a tool called the Casemaker, and they have lots and lots of stats, wider statistics that you can draw in to build your own Casemaker for your local organisation. So what you can do in that is just one page. You can pull in some of the national statistics around relationships and how they impact and outcomes, but also to pull in your own local evidence and to build the case. So it's quite a nice, simple tool. But I'm just going to read out a couple of the statistics here. So, because I think they're so striking in terms of how relationships affect everything really. So one of them is around life expectancy. So this was a review which I've come across before by Holt-Lundstat, which was a review of 148 studies examining mortality rates across all age groups, genders and ethnicities, showing that strong connection increases the likelihood of surviving in any given year by more than 50%, which is just huge. And then a few others which are very relevant to service context. So in Frome, work on building social networks led to a 14% reduction in hospital admissions compared to a national increase of 28%, resulting in a 21% reduction in costs. And of course, we might not feel comfortable about bringing it down to pounds and pence, but actually we know that we have to sometimes to make the case. So again, statistics like that being really useful. So I'm not going to read all those, but there's many others available in that resource which are really useful. So just a quote here from the project, which is, when timescales and deadlines are pushed and you've got waiting lists, there's a tendency for people just to want to go in and fix things and get out, you know, rather than supporting the person to identify what they need and how they're going to get there. And actually how through doing that, we're missing those opportunities to build that sense of wellness and recovery, I guess, for people. So if we move on to the next slide, please, Callum. So in conclusion then, one of the things that we discussed in the workshops was about the struggle for relationship, like any person-centered initiative, actually. And I wish I'd included that quote. Actually, there was a really good quote from one of the community of practice members about, you know, the flux of all of these initiatives over time, how they come into fashion, then they go out of fashion again. And that's very much true for relationship-based practice as well. So Tvithic in 2003, so 22 years ago, already then talking about how there'd been a long-term struggle for relationship-based practice to survive. And I guess that's even more true when there's such challenges in the system and levels of anxiety increase, and relationships are often the first casualty, but actually they're more important than ever in terms of maintaining well-being for staff as well as for supported people. And just to really emphasise the importance of honesty at all levels, and actually some of those difficult or necessary conversations needing to take place at all levels as well, from policy through to practice, about these are the challenges that we're facing, and these are difficult things and they're not easy to talk about, but actually we need to collectively find ways forward. So the importance of collaboration, conversation and building collective purpose. So again, making the space for that is very, very difficult when there's such pressure in systems, but it's absolutely essential. And just to emphasise again that this is not about training staff relationship-based practice, it's partly about getting staff into rooms and talking about meaning of relationships and how that can be supported and what works and what doesn't, what's possible and what's not, and building that organisational culture. So I think there might be one more slide after that, which is some of the next steps that we ended up concluding in the report. So some of the things that we thought would be good to focus on were really around this work on boundary setting, with examples of how to do this in ways that benefit supported people, practitioners and organisations. I don't think we spend enough time or effort on thinking about boundary setting and the importance of it. And then definitely supporting staff with a consistent approach to recording what matters to people, because there's something about those, because then you're getting into the tangibles. It moves out of the abstract into the concrete. and practical ways of supporting this way of working. And recording really is, I mean, we've done some work recently in one local authority area, and we had lots of conversations about conversations, what should a good conversation look like. But it was when we got into the recording that really things started, the real kind of tensions that were sitting underneath everything started to come to the surface. It was really, really helpful. And actually there are lots of organisations, and I can see one or two people in the webinar who've done amazing work on developing tools recently, which let's get the tools shared. Let's get people into rooms and talk about how their tools are working or not working, and avoid everyone having to go through the agony of trying to produce the perfect tool. So yes, and then I guess the bit about, I think it's maybe a longer term focus for the work that Social Work Scotland are leading on, but about how you build communication flows within organisations in response to rapid changes, so that you're holding on to that shared understanding of purpose, process and values, and that people feel confident in what it is they're doing. And I think the proposed work to bring finance and practice closer together is a really positive step forward in improving relationships and understanding between colleagues, which will inevitably improve outcomes for staff and, for more importantly, for supported people. So I think that is my last slide now. And I think I'm handing over to Jane.
Lovely. Thanks so much for that, Emma. I mean, such a rich piece of research that really brings the relevance and the importance of relationship-based practice for self-directed support into the modern context. So that takes us, I suppose, to what do we do now? So we all of our work is evidence-based, and that's why we were so keen to have this piece of research to draw on in terms of our future developments. But I suppose the question then we were left with was, how do we create then the best conditions for relationship-based practice within self-directed support? And we have, over the course of several months beyond the end of the project, been thinking of how best to do that. And we've come up with the concept of a relationship-based SDS practice model. We've brought this, our very nascent thinking about this, to a few different forums over the past few months, and have really received quite a resounding thumbs up for the work. So we feel quite empowered, I suppose, and that we have a mandate to take it forward. And we've included this in our project work stream for 2025-26. So I suppose just to summarise the reasons why we think this is so important to do. Obviously, at the heart of all of this is the dignity and human rights of supported people and carers, and we do see those rights and that dignity being eroded by the current conditions and circumstances. So we feel that we have a moral imperative and a practical imperative to do something, to do all that we can to reverse that and to put that at the absolute centre of practice. We also have, as you know, the SDS standards that we developed along with all of our partners, and many of you here today as well. And those standards say what good self-directed support looks like, and they absolutely support relationship-based practice. So how do we use the standards then as the kind of bedrock of what we're doing, and how do we get them into something that is a coherent practice model for social workers and social work practitioners? So we know that there are there is relationship-based practice out there. We know that it's not everywhere. We know that it's very difficult to do. So we think that by pulling together our thinking into a practice model, something that is teachable to people, something that's learnable by practitioners, something that's doable in practice, and something that we can say that we've done, so that we can evidence is actually working, we think is the best way forward. It'll give practitioners a coherent way of working with the SDS standards, which we know that they are looking for, as we've talked across the country to practitioners about the SDS standards. Now, supported people are obviously at the heart of all of this. This is the function of all of our work, but we also need to stand up for social work as a profession. We know that that it's a very difficult profession at the moment for our social workers to work in. So this is about embedding our professional values and supporting our workforce as well. So that's the kind of why are we doing this. So let's move on to our very initial thinking about where we're going with the model. So many of you will be familiar with this, this graphic. It was developed for our SDS Learning and Improvement Framework, and it is one way of thinking about self-directed support as a journey that the supported person and the various people, including social work practitioners, who support them on that journey. So we're starting off from that perspective in terms of a practice model, and you'll see that already we had mapped on the different stages of the journey. Now, this is a very stylized looking thing. It's not meant to be, you know, something that you kind of absolutely follow to the letter, one step after another, because we know that there are many parallel processes here and many loops and circles in the process as well. But more or less, these are the different parts of the journey that we can look at and say, are we doing this well? Are we doing this in a relationship-based way? So we've taken the journey map as it stands like this, and onto it we've mapped the findings from the relationship-based practice research that Emma has just spoken to us about. The findings from a parallel piece of research that was done with our budget processes workstream that came up with very similar conclusions, very much relationship-based, but digging a little bit more into what the nuts and bolts are of the kind of the planning and providing support aspect of the journey. We've also mapped on the self-directed support standards, and we have also mapped in elements of a theory called the right to need satisfaction that is being supported by the independent living movement. So Callum, if you could move us on. Thank you. So just a few pointers so far. This work that we've done to map, Laura and I have really been doing that just now, so it's yet to see the light of day and be properly scrutinised by our wider partners. So this is more just to give you a flavour of what we think we might be, the sort of areas that we might be including as elements in this practice model. So here are just 6 of what look to us to be around about 30 different practice elements. Nobody said that this is a you know, a particularly simple process, because there are many moving parts to it. So we've highlighted here just 6 of potentially 30 practice elements, and you know, you can see that right at the start of the journey there is almost like a contracting that needs to happen between the worker and the supported person to support everybody's readiness for that relationship to happen. We'll talk a little bit more about that in the next slide. There's a massive piece around the front door, how people get access into whatever the system is. There are lots of locks on those doors, a lot of barriers and chains and things like that. So we need to have a think about how easy is it for people to get the help that they need as early as possible in their journey. Emma's talked a lot about being strengths and outcome focused, and absolutely there are loads of different tools out there. But again, we see gaps in terms of what's being used in a consistent way, what workers are being trained in, what they're able to learn about. So there's something there about making the best use of what's out there at the moment and drawing in that kind of practice into a coherent practice model. As Emma spoke about earlier on, we think that there is definitely a place to use records better to improve people's lives, not just as a sort of passive place where you put all the information, but as an active way of bringing alive the person's story and of keeping that at the forefront. The budget processes group talked a lot about the flexibility about support arrangements, and that's definitely part of our set of standards. And we know that flexibility again has been eroded. So the choice and control that people have at the moment is less perhaps than they should have. And then at the other end, it's the accountability part. How do we check in with people as we go along with them, that we're actually in relationship with them, that we are meeting them where they need to be met, and that we're being accountable for the processes and the systems that we have. So those are some of the key areas that we think are important to develop as we look at a relationship-based practice model. Next slide just drills into to 3 of those. So we've chunked that down. Hopefully you can read that okay. To some of the kind of sub elements, if you like, within these, or the components within these elements. So supporting readiness for relationships. So it's about being truly person-led and asking right at the beginning what the changes that the person wants, not coming in with a big checklist and ticking stuff off, but what is it that the person wants and needs at this point in time. There is a dire need for practitioners to commit to being open, honest and straightforward. Now, we're not laying all of that on social work practitioners. It's more of an organisational thing. But we really have to be open about and honest about what's available in each local authority area so that we can manage people's expectations and work together for the best possible outcome. Some of the other aspects are around that building of trust, credibility and respect, and being able to clearly describe what the practices and processes are that we'll be going through with the person, and that accountability. Going on to the answering the front door element, people have told us resoundingly that everybody needs the opportunity to have a conversation about what matters to them. And at the moment, often the front door isn't open for that conversation, or people have to kind of struggle to know where to go to have a conversation. So these front doors have to be more easily known about and easily accessible. A lot of the barriers are around that are really caused by the medical model of disability, where people have to have a diagnosis before they can get any sort of support or even get a conversation, and that goes against the social work values and principles. So we would want that to more solidly be based on a social model of disability. We need clear information, and we do need to think about novel new ways to leverage community resources to support people. I think over the last maybe decade and a half, the fairly rich range of community developments in local areas, regeneration projects, all sorts of third sector, lovely things, have kind of gradually been eroded away, and there isn't as much as there was locally. So we have to really double down on our ability to find out and to about and to leverage those resources to support people and to invest in those as well. And then finally, drilling down a little bit into what we mean by the being flexible about support arrangements. It's giving people information about what budget they have, actively encouraging them to use their budget flexibly, meeting needs the way the person wants their needs to be met, and as social work practitioners being able to, feeling empowered to argue for and defend flexibility of spend within the system. So that's some of our initial thinking. We're kind of poised now. Callum, maybe if you can move on a slide. We're poised at the next steps, which is to and Laura's doing work on this just now, working out a work plan for this project. But our work streams 5 and 6, we're going to draw them together into a composite work stream looking at this relationship-based practice model. We know that there are many moving parts here that will need individual pieces of work, but that's how we're going to go about the initial starting point. So we'll be back in touch with all of those lovely people that helped us with the research, and we'll reach out further at our next community of practice, which will be now in May, to tell you a bit more about the developments, and to give a bit more information, and hopefully to recruit other folks into this work. It's also abundantly clear that this fits and links to a whole range of different policy areas that are active in Scotland at the moment. So in terms of how such a practice model would be supported by social work education, takes us into the developments around the National Social Work Agency, the Scottish Social Work Partnership, and the Social Work Education Partnership. So we're linking in with all of them. And there's a development of an advanced practice framework for social work that this model would sit in with as well. We absolutely intend to tie it into the principles and practice of getting it right for every child and getting it right for everyone. And we're also actively talking to our colleagues in government around the work that's being done on alternatives to eligibility under the Access to Social Care banner. So all of that's pretty active, and we're fairly kind of we're in and about those spaces, and really trying to get things tied together so that there's no mismatch when it comes to practice. Okay, so I'm going to stop there, and I think we'll turn back to Laura and see if there are any questions in our last 8 minutes or so of the seminar. Thank you.
Thank you, Emma and Jane. That was brilliant. So yeah, without further ado, because we don't have lots of time, I think Anne-Marie has her hand up. So in you come, Anne-Marie.
Thanks very much, Laura, and thanks, Jane and Emma. That was excellent. Lots of hope in there, I think, which is what we need at this time. So thanks for that. My question is around where the kind of the connecting into the community comes into this. You know, using assets that exist in the community before the need to intervene with any formal support. And I didn't see that, and I wasn't quite sure what your thinking was and where in that path, if you like, that would come in. My thinking is it would have been earlier than any of the events that we saw. It may be that you haven't marked them all out, because you did say there was 5 out of so many. So I was just kind of thinking about where do you see that coming in before there's, you know, any need for any formal intervention in the lives of individuals?
Yeah, thanks for that, Anne-Marie. And I think, you know, you're absolutely spot on there. And it comes down to a point that was made at a meeting yesterday about the difference between social care services and support. You know, so it's very much at the beginning of that, of what does the person want? What is it that they have around them that are their natural supports, for want of a better term? What needs to be protected there? And only when there is additionality required would that additionality be brought in, but to fit in with the existing arrangements, because a lot of the time what we see is more of a sort of a blanket offer of here's a service, you can either take it or leave it, and it doesn't always fit with what the person wants or what their natural supports are. So one of our standard core components, I can't remember which one it is now, talks specifically about that paid for support must not interfere with what matters to the person and the natural supports that they have around them. So absolutely, Anne-Marie, that would be.
I think, Jane, just to no, that's really helpful. But just to come back on that, because there's a question then about who does that, and what's the boundary between what other people do and what perhaps a social worker would do. So I think that's a huge question in all of this. Yeah. Because often what comes back from social work is that other people end up doing some of the bits that they would like to do. And I guess it's even further, more of a question given the pressures on social work as a profession. So I'm just trying to work out in my head where all this might fit together.
Yeah, absolutely. I think you're quite right there. And I think, you know, I suppose this comes down to the sort of notion of more of a sort of community-based social work, you know, where social work isn't the gatekeeper to all of this, but is working along with a whole lot of other people in a very equal way. And I think we need to model that out. I think there's some I don't know if any of my colleagues are here from Highland, but Highland are thinking about something promising in that way for smaller island-based communities. So we're very interested in what's happening there. But yes, so I think we would need to look at what does this look like in practice, and this I think is why we're saying it's not so easy just to put some of these ideas into practice within the existing systems. That's maybe why we need a different way of thinking about it, and different sets of conditions there. People will need to work in different ways, but we think that there's potential there to make better use of our existing resource. Does that make some sense?
Yeah, it does. And I think there's room for everybody, but I think it's about not duplicating and then who does which bits of it. So I think there's more than enough room for everybody out there. It's just about being clear about who does which bits of it. So, Sonia, I don't want to hog it, but thank you. That's helpful.
It's great. Thank you, Anne-Marie. Yeah, lots of bits for us still to work together on. Bex, do you want to come in next?
Thanks, Laura, and thanks, Emma and Jane. That was really interesting. And just to say, I'm from Highland, so I'm very aware of the work that's happening there, and very much working in partnership with with social work colleagues to try and realise the ambitions that are there. One of the things that I'd like to say, I found all of that really interesting, and also it brings a real sense of hope. And Emma, I was sharing with Laura just yesterday some of the impact already as conversations are starting to change in Highland in particular, around a very positive review that I was privileged enough to support somebody at the other day in my capacity as an independent support organisation, where very much the focus was on relationship-based practice. So it's really good to see some of the emerging things. One of the things I'm very aware of, though, is this is the first time that I've become aware of your research, Emma. I think it's brilliant, but I do wonder, and it's not a criticism, it's just an invitation to extend things out, that we can't bring about these changes by focusing on social work alone. We need to include social care providers. We need to include independent support organisations for SDS. We need to include community brokers, and we need to include advocacy. And there's probably a whole load of other people as well. So if we're going to want to do this, we need to work together. We can't be working in isolation. So it's just a bit of a plea to, can we have these conversations together? Can we look at that whole landscape together? I think Anne-Marie's just given a really good example of what happens at the preventative part of supporting somebody, and some of those preventative options are there for people throughout their journey, not just because they don't yet need a formal service. They might need some of the preventative things in place alongside a formal social care, social work service. So yeah, I think it's about, from me, it's that plea, let's work together, let's see what we can do between us. And that's really what's brought about some significant change in Highland, is because it's not just an NHS Highland thing, it's about us working together as equals.
Yeah, really well made points there, Bex. I don't know if Laura wants to come in and say something about our thinking around the membership of the work of the group that will be taking forward the work, but certainly we've been thinking how we bring this into the national collaboration space, and talk to colleagues in all of the other organisations, because undoubtedly a lot of this work, like, this isn't just our ideas. Like, a lot of this work is stuff that people will already have been taking forward, and I guess it's about how do we kind of bring it in, so that we have something that we can, again, for me, it comes back to this sort of idea of having a coherent model of practice that everybody's engaged in and everybody kind of comes around, that we can have some agency with, that that we could kind of take to the leaders and say, this is the way that we all want to work together. Laura, do you want to come in and just say a little bit about who we're thinking about?
Yeah, absolutely. I think we need to get a really good sort of cross section of all the different parties and folks involved. It's really, we've had an emphasis on social work because that's where the sort of statutory obligations are, and because we're a social work organisation, and that's where we wanted to start. But it's that research has made us recognise that we've got lots of other people's perspectives to hear. We've started thinking about the work to include people with lived experience. I hope we've got some new recruits on the call today. And we absolutely recognise the need to speak to the other crucial members of the SDS community as well, because we know that it's not just social workers that people will have relationships with. Actually, in lots of cases, their main relationships might be with their PAs, it might be with their support workers, and we absolutely recognise that independent support organisations and the relationships that their practitioners have are key in this as well. So it's how we bring all that together, and that will definitely be a focus of the next phase. I'm really sorry, folks. I think as I predicted, we've absolutely run out of time. I don't know, Alistair and Anne-Marie, with your hands up, whether you want to maybe drop us an email with your questions. We'd certainly be very up for continuing a conversation with anybody who would like to continue to be involved in the work. I'd also say that if you don't know anything or already aren't connected to the work that we do on a regular basis, you can drop us a wee email and ask to be added onto our SDS bulletin, our projects bulletin, so that kind of keeps you up to date with what we're up to. It just remains to say thank you so much to Emma, Jane, but all of you for being here, for your interest. I think the numbers of people involved today and joining us today just demonstrates the interest, and we hope that we have offered a hopeful start to a new conversation. Thank you, everybody.
Thanks,
Thanks, everyone.
Thanks, Laura.
Thank you.
Bye.
Bye, everyone. Bye.